Hey everyone, bringing you another video. In this one I thought we would chat a little bit about how we're actually applying our laser therapy. So, on the end of our probe, what are we doing? So there's two main methods that we can apply our laser therapy. It's either kind of being off contact, where our probe is not touching the skin. Normally we're about an inch above fur line, but the probe is not in contact whatsoever. There may be in some devices a cage, but the actual probe is not actually doing anything to that skin, and if anything, we actually advise not to be in contact at all with a probe that's not designed to be in contact for various reasons. So we'll either have our off contact or we have our contact treatment where the probe is completely in contact, and there's several different benefits for that. Now, it's not to say we won't use, we'll use one method and not the other. There are reasons for using both. With our off-contact style, it might be that there's contamination risk, so maybe an infection, a wound, something like that. We don't want to go touching it. It might be that behaviourally that patient is really, really nervous, or, I've treated some very large patients, giraffes and capybara and a few other things in my time, and there's actually the capybara did let us go in contact, but there are some animals that we're just not going to be able to touch, or that if it's an acute injury that's incredibly painful, in those circumstances we just may not want to be in contact with them because it's so sore. So there are reasons why we would pick off contact, but there's a lot of reasons why we would go with contact. In terms of compressing that tissue, we talk a lot about incidental absorbers, so hemoglobin, oxyhemoglobin, water, fat, all that nice stuff. If we can compress some of that hemoglobin water out of the way, we're going to lose less light to those incidental absorbers. Collimation, some designs, so particularly obviously patented massage ball from Companion, the construction of the ball allows a tighter beam collimation, which minimises energy loss. We get less reflection. If we're off contact with a patient, as soon as that light hits that skin, we're going to lose some of that light. Whereas if we're in pure contact, you're going to get less reflection. Soft tissue work as well. If you're a physio, rehab professional, and you've got massage to do as well, why not let your device do some of the work for you? And studies have shown, that we get better penetration, better target tissue total energy. So there was one study that was done that looked at how light can reach cadaver spinal cords. So what they did, they wanted to compare, off contact versus contact, and they had off contact without skin, of contact with skin, and then contact with skin. And of course, having the skin there means there's more chromophores to get through. We're going to lose naturally more light because we've got more tissue depth to saturate and get through. So what was really interesting with that study was that the off-contact devices, when they measured that depth of penetration in the spinal cord, they only got about 12% of that energy actually reach that target tissue. When they compared it with the contact with skin, we got up to 67% of energy reaching that target tissue. That's a huge difference. We're constantly in this battle when it comes to laser therapy of we want as much energy to get to our target tissue as possible, particularly when we're treating, deep tissue conditions. So if we can go from 12% of our energy to 67%, that's a huge difference. So why wouldn't we want to be in contact wherever possible? So like I say, there are some occasions where we don't want to be, but wherever else, we want to use the benefit of it. And Zine et al, their review on light parameters, again, when they looked at all the many different things that impact whether treatment's successful or not, again, one of the things they found from that study was that the reflection was severely reduced by being in contact than off contact. So something to think about. you know, when we're picking devices, when we're looking at which settings we're going to be used, how we're going to apply the laser, what's the, you know, what's the goal of your treatment? Obviously, if you're doing something really superficial, wound, something like that, contact may not be the choice there. But if we're doing deep tissue, you know, musculoskeletal, abdominal, thoracic disorders, where we want as much light to reach that target as possible, why wouldn't we pick contact? So hopefully that gives you a little bit of an insight as to why you would pick each one, and what the benefits of being in contact can be.